Good morning. Morning. My name is Tracy Hutchings-Getz. I am the Communications and Policy Director with Hoosier Action. We're a statewide, nonpartisan community organization dedicated to improving the lives of Hoosiers. 1 in 3 of whom rely on Medicaid for their health care. That's 2 million people. I stand here today with about 100 people representing over 20 disability rights, faith, and community organizations, some of whom you will hear from soon. We are here to demand that the Marion County Hospital Corporation drop its Supreme Court case against the Talevski family. I want to ask everyone here to raise your hand if you have ever relied on Medicaid, SNAP, TANF, or another safety net program. And I'd like everyone else to raise your hand if you love someone who relies on Medicaid, SNAP, or another safety net program. My brother relies on Medicaid. My grandma relied on Medicaid when she was alive to pay for her long-term care. We are here today representing the estimated 87 million Americans who will suffer if HHC persists with this case. The organizations gathered here together coordinated over 100,000 emails to members of the HHC board and Mayor Hogsett's office. We gathered tens of thousands of petition signatures and offered powerful testimony at last month's HHC board meeting. We are at the City County Council building today asking that Mayor Joe Hogsett join the rest of the City County Council and use all of his influence and power to push HHC to drop this case.
That's right.
This is the only way to ensure that the court does not rule against the interest of his constituents.
That's right.
Whatever the color of our skin or the contents of our wallet, all of us should be able to rely on the safety net when times are tough and when we otherwise would not be able to get the care that we all deserve and need. By threatening to remove the right to individual action, this case threatens to take away the right to justice from the most vulnerable amongst us. And I'm going to now pass it over to Annette.
Woo!
Good morning. My name is Annette Johnson. I am the trustee of Pike Township here in Indianapolis. The people of Northwest Marion County re-elected me this past Tuesday to a second term.
That's right.
It is my honor of my life to serve and lead the 90,000 plus residents of this county in Pike. I call on Marion Health Hospital Corporation of Marion County to withdraw its petition, HHC versus Talevski, from the United States Supreme Court.
That's right.
They should do this tomorrow at their November board meeting. I ask Mayor Joe Hogsett to take immediate action. Please withdraw this. Fox News wrote last week after oral arguments. Most of the Supreme Court justices appear unlikely to embrace a truly outlandish legal argument presented to them on Tuesday, which could have gutted the Medicaid program that provides health coverage to over 76 million low-income Americans. There are over 300,000 people here just in Marion County that rely on Medicaid. As trustee in Indianapolis, I see how Medicaid is a crucial safety net program for our Pike Township families. I do whatever I can to ensure that our families that need help get their bills paid, have enough to eat, and have a warm place to live. We cannot have another portion of something that would bring harm to them. Mayor Joe, you knew my mother, and she voted for you 2 times for mayor. And every other time you ran for office here in Indiana. She is no longer with us in person, but she is here in spirit. My mother was a nurse for what today is the Health and Hospital Corporation. She cares so much about this life-saving institution. She helped form the hospital's first union so that patients could have the best care possible and healthcare workers could serve the community at the highest level. She knew how vital this healthcare system was to our city, then called General Hospital, then Wishart, and now Eskenazi. She would be shocked to learn that the resources of our taxpayers-owned hospital are being used to bring this court case to the United States Supreme Court to cut Medicaid and civil rights protections. That ain't right. I would never quit fighting for civil rights and health care for all, and the people of Marion County. Just this morning, on my way in, I was listening to a song, Just Us. Think about it. The lyrics said, justice for all those in need. That's why I'm calling on justice for those we care for. I cannot comprehend why the HHC board would act in such a way that would harm our nation and our people and the residents of Marion County. Please, Mayor Hogsett, do something.
Good afternoon, and thank you all for being here on this chilly morning. My name is Morgan Daly. I'm the Director of Public Policy with a statewide disability justice organization, and our mission is to empower our peers with disabilities to lead and control their own lives. This morning, we're calling on Indianapolis Mayor Joe Hogsett to stand as an ally with our disability and aging communities and demand that the Health and Hospital Corporation of Marion County withdraw their case in front of the United States Supreme Court. Many have asked if this case can still be withdrawn after oral arguments were heard on November 8th, and the answer is yes. HHC still has the power to withdraw this case until the Supreme Court issues a decision, which often takes multiple months. We still have time. Friendly reminder that this case never should have happened. The executives and lawyers of HHC decided behind closed doors to take this case without input or approval of the HHC board, and they also denied public access. Indiana's public access counselor has ruled that HHC violated Indiana's open door law, which has prompted another lawsuit. HHC should withdraw this case on the sole fact that they denied public access, but they should also do so because it directly contradicts their mission, which I will read for you today. HHC's mission is to promote and protect the health of everyone in the community and provide health care to those who are underserved. Taking this case makes no sense. A win for HHC will destroy the social safety net for those who need protection and removes access for those who are underserved. That ain't right! So again, Mayor Hogsett, we ask that you ally with our disabled and aging Hoosiers and direct Gregory Fairbach, Carl Drummer, Robert Lazard, Dr. Gita Karnik-Matravati, Monica Crane, Thomas Hannafy, and Beverly Mukes Gaither to stand behind HHC's mission and withdraw this case immediately. Thank you all for being here to stand up to protect Hoosiers, our disabled and aging community, our multiply marginalized communities, and millions of Americans.
Thank you, Morgan. Good morning. Good morning. Thank you. My name is Lane Fulton, and I'm a member of Hoosier Action. Like 2 million Hoosiers, thank you, 1 in 3 of us, I am on Medicaid for my healthcare coverage, specifically the Healthy Indiana Plan, or HIP 2.0. Having quality healthcare I can afford during a global pandemic saved my life. Were it not for the coverage I had, I would not be here today working hard to make sure that no one has to feel how I felt these past years. I have also experienced firsthand how dehumanizing our safety net systems can feel, and how hard you already have to fight to receive the care and rights we all deserve. When I applied for Medicaid in summer of 2020, I thought I knew the systems well. I am a public affairs professional that specializes in how services are provided to the public. I have advanced degrees in exactly how programs like Medicaid work. Going through the system firsthand was a much needed awakening for me. No amount of training and no amount of preparation can make anyone ready for how the process makes you feel. I did everything by the book. I still felt lost and hopeless. When I needed a helping hand, I was given more questions than answers, more hoops to jump through, and countless unexpected delays or denials along the way. Even after I was fully in the program, I was met with roadblocks the whole way. While on Medicaid, I have been denied healthcare coverage when I needed it most. I have had 6 surgeries in just a 3-year period as a result. Even though my doctors knew I needed care, the state deemed it a luxury. Had my appeals been successful, 3 of those surgeries could have been prevented. I was mad. I am mad. I got even madder when I found out that the Marion County Health and Hospital Corporation continues to pursue a lawsuit which could make experiences like mine even more common. If HHC prevails in their case, people like me will lose their right to sue if the state officials unlawfully deny, reduce, or terminate Medicaid benefits guaranteed by federal law. That ain't right. There is no need to put the care of millions at risk when we should be doing more to protect and improve the vital safety net program. We can do better. We deserve better. It is possible. All of us here know it. That's why I'm calling on Mayor Hogsett. Hello, Mayor Hogsett.
Mayor!
Thank you. To join us and demand that HHC withdraw this harmful case at the Supreme Court. Thank you very much.
Good morning, everyone. I'm Reverend David W. Green, Sr. I'm standing here on behalf of Baptist Ministers Alliance under the leadership of Dr. Wayne Moore, also the National Action Network of Indiana under the leadership of Pastor Stephen J. Clay, and myself as the president of the Concerned Clergy of Indianapolis. I truly believe that we're gathered here today to fight for our seniors and those who suffer from disabilities. I'm excited to see the different organizations who've assembled this morning to take a stand for the fairness in the treatment of those who represent the most vulnerable in our community. While we're not all under the same banner, we're gathered this morning committed to the same battle. We're not here today as Democrat, Republican, or Independent. We're not here this morning as the religious left or the religious right. We're standing in the moral center of our deepest constitutional and religious traditions.
That's right. That's right.
We're here because we see Indiana in a moral crisis.
Right.
We're asking the Mayor, Joe Hogsett, and Health and Hospital Board to be willing to listen to the community in the strongest possible terms. We urge you to withdraw the request for the U.S. Supreme Court to rule on the case of Health and Hospital of Marion County versus Talevski. If successful, the Health and Hospital Corporation request has the potential to roll back civil rights laws in the United States, blocking access to courts for tens of millions of the most vulnerable citizens across our state and across our country. We say to the mayor that as an attorney, you know that Health and Hospital is providing the Supreme Court with a platform to issue a ruling that would make it very difficult to hold the government accountable for violating the rights of people who depend on federally funded safety net programs. The Supreme Court could rule in a way that would severely limit the rights of many victims of nursing home abuse. While with the profit of the 78 nursing homes that Health and Hospital owns across the state being directed to other places rather than on improving the quality of the nursing homes, we see this as insensitive and immoral. Absolutely. It's an immoral act against our seniors and those with disabilities. Also, with the number of elderly African Americans in nursing homes in Marion County, we see this mistreatment and profiteering as a racist attack on many aging African Americans, all people receiving social service benefits in the state of Indiana and across the country. To Mayor Joe Hogsett, the board, and the leadership of Health and Hospital, we say, it's not too late to do the right thing.
That's right.
Listen to the concerns of your community and advocates around the country and withdraw your petition.
That's right.
We appeal to your moral conscience with the words of what Dr. Martin Luther King said. There comes a time when one must take a position that is neither safe nor political, nor popular, but he must take it because conscience tells him it is right.
That's right, Reverend.
I'm also reminded of the words of Isaiah. Woe to those who make unjust laws,
Absolutely.
those who issue oppressive decrees, to deprive the poor of their rights,
That's right.
and withhold justice from the oppressed of my people. Again, Mayor Hogsett, we urge you, do the right thing. God is watching.
That's right. That's right. That's right. Preach it.
Yeah, I want to thank everybody here. My name is Lucas Waterville. I'm a resident of Indianapolis. I would just like to say, as a recipient of Medicare, Medicaid, and Social Security, I think this petition needs to be withdrawn.
That's right.
I know this has to be withdrawn because as a recipient of Medicaid, as a person that gets 12 hours of care a day, as a person that always has to fight for every benefit
That's right.
I receive, just one more block, one more strip of red tape in the way of me fighting for my right to have my benefits, to have the benefits that I need to live and survive, is detrimental. My benefits mean life or death for me, and it means life or death for every recipient that receives them. And on the flip side of that, this case means getting rid of a headache for HHC and getting rid of lawsuits and just getting more profit for the already profitable healthcare system. So what they're doing to us is saying the most vulnerable don't matter. Yeah, the most unhealthy don't matter. The elderly don't matter. The disabled don't matter. What matters to us is profit. And I'm saying that shouldn't matter.
That's right.
What should matter is health care. What should matter is us having the right to stand up against the state and fight for our rights for health care. So I join with my brothers and sisters to urge the board and Mayor Joe Hogsett to rescind the petition today, not
That's
tomorrow.
right.
Today.
That's right.
And they can do that. They
Absolutely.
can do that. They're hiding behind legal mumbo jumbo, and they want us to be confused, and they want us to be disheartened, but we're not. We're standing up and saying this is right. So rescind the petition. We beg you. Thank you.
When our health care is under attack, what do we do? Stand up, fight back! When our health care is under attack, what do we do? Stand up, fight back! Okay, thank you all for coming out today. We will now take questions from the press. If y'all have any questions you'd like to ask of our speakers.
Have you today gotten any response personally from any of the from the board or from the mayor's office?
We have not. We did invite the mayor and the mayor's office to join us today, and unless there's someone I'm not seeing, they have not been able to join us, it looks like.
How soon could, I know the Supreme Court could make a decision, it could take months, but could this impact people in the short term?
So, Morgan, you may want to answer this as the attorney, but it is my understanding that until there is a ruling, it would not impact people. So, short term, we're okay, but the case needs to be dropped. It's the only way to prevent it from moving forward.
There is still an administrative process for families to go through, and the state will still retain the right to hold agencies accountable for accepting the funds. Sounds like you don't have confidence in that system.
Yeah, Morgan, I don't know if you want to speak to this, but while those rights remain, we know that the caseload, so that if the federal government had to step in every situation when care was denied by the state or coverage was rescinded, that the caseload would be far too extreme.
Yeah, and I'll just add that sometimes folks ask, well, couldn't you bring a medical malpractice claim against a physician or a nursing facility for overprescribing? So in this case, psychotropic drugs. Indiana has some of the most strict medical malpractice laws that protect physicians in the country, making it almost impossible for folks to go that route, which is why the private right of action under 1983 is so important.
Thanks for helping to keep the plaza clean and comfortable. Deposit
Any other questions?
provided. Thank you. Enjoy the plaza.
Okay, thank you so much, and have a good day, everyone.